Welcome to Hamid's podcast. This is Kerala's first podcast. Like many, I too have a reason to start this podcast. I used to be a journalist. At those days, I met a fellow Malayali called Gopi Kallayal. He's Google's chief evangelist. When I talked to him, he was saying as a kid growing up in Kerala, he used to travel 8 hours a week to get few books to expand his knowledge. But today, we have that knowledge in our hand. It's in our fingertips. And as a journalist listening to that story, I took a bit off. But then I thought to myself, as journalists, are we doing enough to give the right information? Then I thought journalism has a purpose. You spread knowledge and awareness. But is enough of that being done today? We need more stories of people who really makes a difference. We need to know more and learn more from people who can inspire and also that who can spread knowledge. We need to acknowledge these people, like the one who's joining us today. She deserves every bit of praise. Her name's Dr. Priyanjali Datta. She is the recipient of Top 50 Global Healthcare Leaders. She's the youngest woman entrepreneur, a doctor who decided to become a social entrepreneur. She's a CEO of Aroogya, an organization that reaches 3 million people across rural India. And she has set as goal to reach 5 million, 50 million people, 50 million people by 2025. She has represented our country in several global forums. She has been covered in many magazines like The Femina. Dr. Priyanjali, I welcome you to Hamid's podcast.
Thank you so much.
It's an
That's a
honor.
great introduction.
You deserve it. It's really an honor. You're our first guest, and
Thanks.
so everything. I hope this will certainly be a success, like all the other endeavors you have indulged in. And Dr. Priyanjali, I know you
Yeah.
love classical dance, and you're very good to your traditional roots. So how good are you in dancing?
That's a very nice question. Probably you have started with the favorite part of mine.
Mm-hmm.
Uh, I grew up in Meghalaya and I am a Bengali,
Mm-hmm.
was born in Calcutta. So my family is too much into art
Mm.
and art is not a profession, it's a way of living life for us.
True.
So typically, learning to dance and singing, painting is
Mm-hmm.
something that is categorically taught to us without any questions. It's a mandatory schedule to do.
Yeah.
In my family, it was not just a schedule, it was very emotional
Mm-hmm.
because we connect with art uh, and we respond better with art.
Mm-hmm.
So I was very fascinated with my mom's skills to teach classical dance and music to kids. And she never charged anyone. She just did it out of passion for years.
Mm-hmm.
I saw her, for 2 decades teaching thousands of kids
Wow.
in remote area where I have grown up. It's
Um.
not even in Shillong city.
Uh-huh.
It's in between jungle and it's a place called Umyam.
Oh my.
So yeah, Umyam. And it's very difficult for people to have access to anything there.
Okay.
2G is now working there, so that's the kind of place it is.
Oh.
But we have been very, very, you know, conservative in keeping the nature
Hmm.
and its treasure intact.
Mm-hmm.
So, uh, yeah, I think classical dance has been my way of expressing myself. And even today, when I am not able to think clear,
Mm-hmm.
I just put on music and dance, and my whole family loves doing it. We just do it out of an impulse, which is inherently there in us.
That's absolutely.
And even my father loves. Uh, he wanted me to become an actor.
Oh, actor. You would have been a
It,
wonderful one.
thank you. So he was pretty adamant to put me in dance school and acting school
Uh-huh.
and send me to um, Pune instead
Uh-huh.
of Delhi, but I mistook myself to be an academician and came to Delhi for medical.
Yeah.
So yeah, I think classical dance or the whole art in me uh, is a very important part of my life because that's how I express the best. So yeah,
Hmm. That's wonderful. Speaking about growing up in Meghalaya,
yeah,
you said it's a place which is strong on matriarchy. People, women get equal
yes,
respect. I could understand that a
yeah,
bit because Kerala is a similar place, and but and
yeah.
I think that is that what helped you? This freedom, is that what helped you become such a young achiever and go progress? Just take on life like that.
Yeah, I think that society, the entire upbringing,
Mm.
and my very early shift to live as a teenager in Delhi alone
Mm.
has really given me challenges.
Mm.
So, growing up in a society where women is the bread earner
Mm.
and there is no concept of feminism because
Mm.
it is so inherently and naturally women driven
Mm.
that every woman in Meghalaya is an entrepreneur, small
Mhm.
scale, medium scale,
Mm.
large scale, uh, self-sufficient people because uh, we build our own houses,
Mm.
we grow our own vegetables,
Mm.
we bake our own things. So I think earning money and doing all the work like efficiently by our own self
Mm.
has been the way of living.
Mhm.
So that gave me a really positive upbringing,
Mm.
which played a vital role in being a self-starter, I think.
Oh.
Uh, Coming to Delhi
Mm.
was challenging because it is entirely a different culture and different environment, very cosmopolitan, very cross-cultural, very different challenges.
Mm.
I will not nag about patriarchy here because that's something we all nag about.
Yeah.
But yeah, it was different. I started living alone from the age of 15.
Mm.
So it has been quite challenging for me to balance between
Mm.
both the world. So I think, yeah, that has really given me an edge to what I am able to do in my own capacity.
That's wonderful. I think we should take a leaf out of this book. Every state should implement that.
Yeah.
I was talking to one entrepreneur in the UAE recently, and they're saying that even today, though
Hmm.
50% of their workforce is women,
Yeah.
there's a rule over there that women should have equal pay. But despite being
Yeah.
10 years senior, there's a pay gap, and it still is prevalent all over the world, whether be
Yes.
so.
Yes.
That's a sad thing. Anyways, moving on.
Yeah. Yeah.
So explain a bit about your organization, Aroogya.
Yeah. Okay. Um, so Aroogya uh, was a reason for me to have a understanding on my own
Mm.
capacities and capabilities.
Mm-hmm.
It is more than an organization for me personally because, as I told you,
Mm.
when I shifted to Delhi, I gave my entrance exams and I did pretty well.
Mm.
And again, I was in a delusion of academia that, okay,
Mm.
this is the world I belong to.
Mhm.
Uh, Also, I got some proofs that, okay, I topped in my um, entrance exam. I secured seventh rank all over India.
Oh.
So all those things gave me an illusion that, okay, this is what I'm made for. What education do to us?
Mm.
Tunneling keeps tunneling us,
Mm.
and we lose the larger awareness about ourselves.
Mm.
While in my course in second year onwards, I started realizing that, okay, there is this is really something I love. I love studying. I love my books.
Mm.
I love learning science. but this is not I want to do professionally.
Mm.
I don't want to limit myself to clinical practice only.
Mm.
I want to create something.
Mm.
That's what I have always wanted to do.
Mm.
So I spoke to my father and he said, okay,
Mm.
fine. I have always told you you should, explore yourself more.
Mm.
Hence, I decided to begin working on ground and see what are the challenges and how can I develop a solution.
Mm.
The best challenge that came to my mind in third year onwards was breast cancer.
Mm.
Slowly, oral cancer, because we were exposed to patients
Mm.
who were at late stages of these cancers,
Yeah.
cervical cancer. So
Mm.
these three cancers keep coming
Mm.
as very common cases in their late stages.
Mm.
In between time, I also, got a little bit of shock because my mom was
Yeah.
diagnosed with a rare disease.
Yeah.
It's a precancerous condition,
Okay.
uh, and there is not enough research, evidence, and protocol of treatment to cure it precisely. There is no cure for it.
Oh my.
Uh, she's just on general chemotherapy pills since 3 years now.
Okay.
I think more than that, almost 4 years. So there is lack of research there.
Yeah.
So it really gave me that push, which no one can explain when we get that push.
Absolutely.
And while my PG co-mates and everyone were doing their preparation for All India post-graduation,
Mm-hmm.
I was determined that I have this time when, before moving out of college, during my internship, I have to build an organization so that I have a base by the time I go out.
Mm.
So I started doing my groundwork in Delhi NCR and my home state, Meghalaya.
Mm-hmm.
And Aroogya's concept is about prevention
Mm.
and early detection of the three cancers that I told you about.
Yeah.
Uh, these three cancers are lifestyle originated
Mm.
most of the time, 80% of the time,
Mm.
like tobacco
Mm.
consumption,
Mm.
like for breast cancer, late marriages, late kids,
Mm.
uh, and for cervical cancer,
Mm.
it is lack of hygiene, personal hygiene,
Mm.
early marriages, more number of kids,
Mm.
lack of use of contraception,
Mm-hmm.
uh, unsafe and unclean, toiletries and
Yeah.
everything.
Exactly.
So these are very basic things which can be controlled.
Mm.
On the contrary, what I noticed was that in Asia,
Mm.
the numbers of cancers were rising tremendously, but the number of deaths were even more alarming
Oh.
because of late detection.
Oh my God.
Hence, hence I started developing protocol with, good, very experienced doctors in the field,
Mm.
because they are the ones who can really give us the best of knowledge base, how to prevent and how to do self-check and self-awareness
Mm.
and early examination in low cost.
Mm.
Since then, Aroogya has worked in few districts in 5 states,
Mm.
and we have worked with 51,000 plus beneficiaries.
Oh my.
We have diagnosed somewhere around 2,900 odd patients
Oh,
cancer
that's
in
impressive.
early stage.
Oh.
So the good thing that it did was, they got diagnosed early, right?
Mm-hmm.
So they know
Mm.
that okay, they have a scope of living,
Mm.
they can get cured.
Mm.
B, the biggest problem solving here is that instead of, I'm just giving you random numbers, instead of spending 40, 50 lakh rupees in late stages,
Mm.
where the ultimate result is not cure
Mm.
but only palliation, that means the person will not live
Mm-hmm.
most probably,
Mm.
versus that, diagnosed, if someone is diagnosed early, that person gets treatment in uh, one third the cost
Oh.
and they can live.
Mm.
So practically it's saving billions of rupees of patients and government
Yeah.
if it can be organized
Mm.
at a
Mm.
mass scale.
Mm.
So this is what Aroogya is all about.
That's a wonderful cause. This is exactly why you're on the show because more people need to be aware of this and
Yeah,
what Aroogya does. And
yeah,
so you're saying that despite like a place like Meghalaya, which has a good genetics and hereditary,
yeah,
they have a good diet. They are the cancer
yeah.
capital of India.
Correct. Absolutely. Northeast is, in fact, Mizoram is at the highest alarming level.
Mm-hmm.
I'll tell you the reason,
Mm.
because taking a case study of Meghalaya,
Mm.
it's a tobacco growing state
Hmm.
primarily,
Hmm.
and women have their earning sources from growing that tobacco and selling it. So if you ever visit Meghalaya,
Hmm.
you'll see every single person chewing tobacco
Oh my. Oh.
all the time, all the
Oh.
time.
That's.
And very frankly, since it's a society where choices has been very very fundamental and liberal,
Hmm.
people get married uh, quite a few many times
Hmm.
as if they want,
Hmm.
and it has not been a very conventional society like the mainland India, where people have been in marriage for a very long time, and recently the divorce cases are happening. So, multiple sexual partners, or
Hmm. Hmm.
a little bit of here and there,
Hmm.
more number of kids, or a little bit of lack of hygiene. People are exposed to more risk factors to developing such cancers. Um, so yeah, Meghalaya is a good case study, very very interesting case study to do.
Is that a observation that you have made, or is that some like this is absolutely new to me? Because the
Uh,
multiple partners and all that can lead to cancer.
right,
So that is something not many people are aware of.
right. If you look at, this is my personal observation for sure.
Mm.
But if you look at the interventions that's happening by the government of India
Mm.
and Tata largely,
Mm.
is focused on cancer prevention in Northeast,
Mm-hmm.
because Northeast has the highest level of cancer incidences.
True.
I'll tell you the reason, because you asked me about the food practices.
Mm.
Uh, we eat very healthy.
Mm.
We don't eat very spicy or fried.
Mm.
That is true.
Mm.
On the other side, the food habits has been very, very, fermentation oriented.
Mm.
So you never know what bacteria is coming in and coming out.
Mm-hmm.
Secondly, we have a very indigenous habit of having hot chilies,
Mm-hmm.
very hot chilies.
Mm.
Hence, that affect the stomach and intestine and food pipe.
Mm.
I told you about tobacco chewing,
Yeah.
which affects a lot of mouth and lung area.
Mm.
Um, and if you talk about some more food practices, like we drink a lot of black tea,
Mm.
and the habit is to have it a lot in one day,
Mm.
and it is hot,
Mm.
very hot.
Mm.
So that hot tea also causes some damage to the food pipe and all.
Mm.
So yeah, these are some basic, practices
Mm.
which leads to more number of such diseases.
Mhm. So, you will say that more than 60 people detected with cancer don't survive.
Yeah,
Is early detection sufficient enough to make a change to that statistics?
yeah, yeah. Currently, in our continent as a whole,
Mm.
uh, because of lack of awareness practices,
Mm.
as basic as washing hands, brushing teeth,
Mm.
these practices are not in our regular day-to-day life.
Mm.
Like early detection can lead to savior of such diseases is not known to many people, because people really get scared of
Yeah,
uh,
absolutely.
words like cancer,
Yeah.
and they feel it's a very deadly disease, while
True.
diabetes is also a very deadly disease.
True.
Both are metabolic.
Mm.
Both diseases are lifestyle coursed.
Mm.
Hence, uh, we need to make it easy for people to take it lightly
Mm.
and be accountable for their own health, because the rate of increasing of this number is very alarming.
Mm.
Uh, as WHO has suggested recently, that
Mm.
by 2030, 1 out of every 10 Indians will encounter cancer in their life,
Mm.
which is quite a big alarming number.
Mm.
Hence, early detection is something that everyone has to have in their own hand as a tool,
Mm.
just like they brush their teeth,
Yeah.
and change the numbers from what we are currently seeing, that 7 or 8 out of 10 people die
Mm.
when they have cancer.
Mm.
We can easily shift the numbers in due course of time, because if you're detected early, the simple thing is
Mm.
you will be cured.
Oh my God, that's wonderful to know.
Yeah,
Yeah. So, unfortunately, there's a sad truth. I think there is a considerable amount of people in India who
yeah,
would just ignore the fact that they have cancer because they think it's out of their
yeah,
reach because they can't have the financial aid to.
yes,
Yeah.
yeah.
So they don't
But
want to.
I think,
Yeah. Please.
we ignore a lot of signs and symptoms
Yeah.
ourselves.
Hmm.
Not only in cancer,
Hmm.
in general day-to-day life, we ignore our signs and symptoms. I
Hmm.
do it myself so I can understand the psychology.
Hmm.
Um, and I know it's a tough thing to inculcate because habit is something which we take
True.
decades to inculcate.
Oh my God. Yeah. It's also
Yeah,
overwhelming to hear. I'm
yeah,
sure interacting with such people would have changed your life immensely. It would have affected you in a way like never imagined, right?
yeah,
And
yeah,
especially you have a personal experience that someone in your family.
yeah,
It's so sad to listen to.
yeah,
Uh, and you also say that within the next year, 5 years, the cancer rate will rise 19% in men and 23% in women. I've read it
right,
in one of your articles. So, how
yeah.
far ahead is our country prepared for this?
Our country is really prepared. The problem is not about how prepared we are with the resources.
Hmm.
The problem is, yes, we have enough resources, we have enough expertise,
Hmm.
we do not have enough skills to deliver that. We
Hmm.
do not have enough, organized distribution
Hmm.
to deliver that.
Hmm.
Uh, so I think with the correct assistance of tools and technology
Hmm.
and enhancement of more communication,
Hmm.
the experts, the doctors, the specialists can be enabled
Hmm.
to just pass on in a very easy manner
Hmm.
their expertise on ground
Hmm.
to the people who are in remote areas like ANMs and ASHA workers and Anganwadi workers
Hmm.
who are directly in touch with the local community.
Hmm.
And I think if there's organized communication
Hmm.
and an organized simple protocol handed over to them with the help of technology,
Hmm.
this can be easily met at least at the prevention level.
Hmm.
And that's what we are trying to do right now.
Oh, that's wonderful. And your organization has also made a pledge to reach 50 million women for prevention and
Yeah,
early detection of cancer.
right,
That
right.
sounds like a lot of financial
Yes,
assistance is required. How do you find, how do you make aware that this is unique? Because this is something that must be done.
yeah, it's a big number.
Yeah.
So, apart from thinking as a single entity to reach that number,
Hmm.
there's a lot of thought behind putting that vision out.
Hmm.
We cannot do it alone.
Hmm.
We will not be able to do it alone, and we don't want to spend our energy on thinking how can we do it alone.
Hmm.
We have put a number by believing that the kind of product and protocol we are building,
Hmm.
we will use the existing wirings that
Hmm.
is available,
Hmm.
mostly the government entities, the frontline health workers,
Hmm.
the existing CSOs,
Hmm.
and private partners
Hmm.
to adopt to what we are building
Hmm.
and spread at multiple levels
Hmm.
rather than just we as one organization doing it.
Hmm.
So the effect, the reach, the outreach, the impact will be multifold.
Hmm.
Hence, the funding that will arrive through, we believe,
Hmm.
is uh, going to be at multiple levels.
Hmm.
One, definitely for the execution of, whatever we are building.
Hmm.
I'm sure that comes under interest area of a lot of uh,
Hmm.
government interest right now.
Hmm.
A lot of corporates who are trying to develop such solutions because cancer is an interest area for a lot of people like Tata,
Hmm.
and also a lot of technology company like Dell Foundation is working on it.
Hmm.
Hence, I think there is a lot of scope of collaboration
Hmm.
and also a lot of scope of raising funds in India.
Hmm.
We will also try for grants
Hmm.
from international organizations
Hmm.
who are building um, who are giving grants to such impact SDG goal oriented organizations,
Mm-hmm.
because they have a much wider and larger goal to address, that is good health, as the Sustainable Development Goal 3.
Mm-hmm.
So I think if if we are able to, not just us, if anyone is able to build an optimized um, solution where a particular problem can be addressed at a large scale,
Mm-hmm.
I think that has a good enough potential to be funded from various sources.
Mm-hmm.
So we recently got an innovation grant from ENCORE and Cisco
Mm-hmm.
and Niti Aayog, and every in every cohort they take 10 promising social ventures in the not-for-profit sector, and they give some innovation grant and also give them mentoring and create their further pipeline of funding
Mm-hmm.
in 6 months. So I think these kind of avenues will help us for that audacious goal.
That's wonderful. Yeah. I hope you find every bit of success because we really need you to find it for us.
Sure.
So
Yeah.
I just want to ask, how does artificial intelligence help in
Yeah.
cancer detection?
Okay. Sure.
Yeah.
So artificial intelligence is a tool
Hmm.
which enables faster analysis in anything.
Mm-hmm.
In case of cancer,
Hmm.
it really helps in cases where in remote areas, skilled doctors and specialists who are very less in number
Hmm.
cannot reach.
Hmm.
I'll give you a small example with thermomammogram that we are using
Hmm.
by the company called Miramai,
Hmm.
who is doing a wonderful job.
Hmm.
They have developed a solution where all the points on the breast area
Hmm.
is imaged and
Hmm.
recorded,
Mhm.
in which the temperature of each cell and metabolism rate is analyzed.
Hmm.
If we do it manually, it will take days,
Okay.
hours
All right.
by a skilled professional.
Hmm.
Rather, in 20-25 minutes, the whole procedure happens and the analysis is also done in
Oh.
a decent internet area. Yeah.
Whoa.
So it it's a very smart screening solution.
Uh huh.
And if there's a red or yellow flag,
Hmm.
is when the patient is further sent for advanced diagnosis to
Hmm.
confirm. So I think that's how AI can really help and be assisting in nature
Hmm.
to specialists and doctors to deliver better quality and valuable screening methods in remote areas.
Hmm. What more can be done from the government side to support you
Hmm.
and also the cause?
Uh, okay, that's a very important question and very good one.
Mm-hmm.
The government is currently spending almost 1% of their GDP, if I'm not wrong, on public health,
Hmm.
and which is roughly rupees 3 per day. I'm not sure about it. And it is quite less than the other neighboring countries we have, like Thailand and Sri Lanka.
Hmm.
So, but government is also spending a lot of rupees at the
Hmm.
tertiary care segment.
Hmm.
So if they just organize their funds and divulge it a little more, which I'm sure they are doing now, on the primary and the preventive healthcare aspect, and fund organizations like um, us or some private social ventures for profit, anyone who is working in public health sector
Hmm.
and trying to deliver care at the very first level. So I think government has to have some policies, some strategies, and some organized funding towards that segment.
Hmm. That's great. That's wonderful to hear. I hope those someone listens from the
Here's
government
it.
side.
Yeah, yeah.
Yeah.
I also hope.
Yeah. So,
Yes.
as I was, there's this conception that living a healthy life
Hmm.
is going increase your longevity. But does that a lifestyle, healthy lifestyle, prevent cancer?
Yeah. Uh, Living healthy life. So okay, I'm very motivated by this word called living a healthy life because I myself am struggling to do that.
Yeah.
It's tough to do that.
Yeah.
Uh, but I believe that they are definitely coincidental.
Mm-hmm.
Um, they coincide, both the word good health and wellness and staying away of cancer, because if we have the right sleeping hours, the right diet,
Mm-hmm.
the right discipline in our health, and if we take care of our health like we take care of our work,
Mm-hmm.
I think a lot is preventable, and cancer is one of them. So I think good health is the larger solution to get to stay away from not only cancer but a lot of non-communicable diseases.
That's wonderful. So my last question is it's not of some it's not a question actually.
Yeah,
I I came towards you and your body of work from Dr. Ruji. Dana.
yeah,
She's actually one of my inductees in the top 20 books of
yeah,
GCC. For
yeah,
the listeners, she
yeah,
is the board member of Dana Group, top 75 family business leaders, and she is a
yeah,
recipient of Yuva Ratna Award. So
yeah,
I think even she does something similar. I mean, she has something in US which tries to develop uh,
yeah,
technology. So
yeah.
your opinion on her?
I think, the first time I got to know about her and I
Mm-hmm.
met her in Vegas.
Mm-hmm.
And I was so amazed by, firstly, the kind of human being she is.
Absolutely.
She's so amazing, so down to earth, so
Absolutely.
forthcoming, and so helpful
Yeah.
that her aura, her presence, her the way she conducts herself is really amazing.
Absolutely.
Um, and in terms of being a professional, I think she is extremely intelligent and very, very um, efficient as a person, because she really knows well how to connect the dots and
Yeah.
bring a sustainable solution out.
Yeah.
Uh, Looking at her background, she did her medical from Aligarh Muslim University,
Mm-hmm.
and then at that time when for a girl reading was a challenge,
Mm-hmm.
she did her masters in Stanford and took innovation as a path.
Mm-hmm.
So I think as a student only, she has been always driven by innovation, and she has been actively working on the medical technology to, as I told you, cut down the
Yeah.
problems of reaching out to people, or cut down the problem of more time in delivering a treatment or diagnosis.
Mm.
I think she's playing a pivotal role in that segment,
Yeah.
and I think I have a lot to learn from her. So
Yeah. I'll tell you
uh,
something funny about her. Like
yeah,
you'll be sending a mail or something to her, and
yeah,
or she'll be responding to it by 1:30 at the night or something. And
yeah,
we'll be having a conversation then, and she would be saying, "Oh dear, you shouldn't be working so hard." Well, while she's still working.
yes.
so, so, so she
She's very sweet.
yeah, yeah,
She's yeah,
she's like
yeah.
working all the
She's
time.
all the time working.
Yeah, and she would advise us, don't work too hard. You're working too hard.
Yeah, yeah,
Yeah,
yeah.
so she's
True.
that kind of a person. Very nice person.
Yes.
Very nice.
Very nice
So,
person, absolutely.
so one thing I want to say is that you women like Ruji and yourself, we are absolutely inspired by you, and
Thank
we
you.
wish you all the health and prosperity because we need you. This country needs
Thank
you
you.
because
Thank you.
that is why this is so important, and I wanted you to be my first guest because I'm absolutely inspired by you, motivated by you, and I hope this podcast helps Aroogya
Yeah,
because
yeah.
not for because it's for a cause, and there's no other biggest cause than saving a life.
Right.
And in
Absolutely.
the Quran, it says that you save a life, you save the whole of mankind. So,
Wow.
there is no bigger act, and you are truly one of the gems of this country.
Thank you.
Thank you, doctor.
Thanks a lot.
Thank you for
Thanks.
being
Your
yourself.
quote from Quran made my day.
Anyway, so thank you for so much, and ladies and gentlemen,
Thanks.
that's Dr. Priyanjali. Thank you for having me on your podcast.
Thanks for having me.
Yeah.